This is a little webinar, little video to give you a bit of information about the ANZICS data for the datathon. We have essentially two data sets. There's the adult patient database and the critical care resources registry that I'm going to talk about today, hoping to have some more information about some pediatric data that'll come later. What we've got in the adult patient database is about 1.3 million individual ICU records. We have basic demographic information with the ages of the patient between 16 and 100. Information on the chronic health status, chronic cardiovascular, respiratory, liver, renal disease. That means whether you're on dialysis or whether you've got cirrhosis, essentially, whether you've got metastases or leukemia or lymphoma. All of the data comes from Australia and New Zealand. It's all been lumped together, so you can't tell whether you're a Queenslander or a Kiwi. It's all in there together. There's individual patient data on the highest and lowest values of hemodynamic data from the first 24 hours of ICU, biochemical data, blood gas data. We've got information on whether the patient was ventilated or not. Unfortunately, what we don't have in this data set is information on inotrates, renal replacement or tracheostomy or the duration of ventilation, but you know whether they were ventilated in the first 24 hours. There are severity scores, Apache 2, Apache 3, Apache 3 risk of death, the ANZ risk of death. That's the most accurate estimate of the predicted mortality for these patients. And there's also subscores. So if you want to work out what the relationship between an individual element like sodium, there's a sodium subscore, which is the bit that goes into these. Importantly, there's the outcomes. So for the outcomes, for the patients, you know whether they went home, whether they went to another hospital or chronic care, whether they died. And from that, because every line is an ICU admission and one patient might have multiple lines for if they're readmitted to ICU 2 or 3 times within the same hospital, so you can tell whether the patient was readmitted. And all of that information there is 1.3 million records from 183 ICUs. The other data set that we've got, that's one big flat file. The other data set is the critical care resources registry. That's about 200 ICUs. Financial year data gives you the staffing level, whether they do processes, like whether you've got a pharmacist in your ICU, whether they do antibiograms, those sort of things, the number of beds, the occupancy of that ICU for the year, your medical staffing, your nursing staffing. If you want to look at the relationship of that to outcomes, these two data sets, you can put them together and investigate those sort of things. If you want to look at the incidence and outcomes of patients with sepsis or with trauma or with a specific diagnosis that you've got an interest in, like overdoses or something, you can look at this data that's 1.3 million patients. That size of data can allow you to pick up small differences, but obviously you can't look at the things that you don't have information for. If you have questions, come and find us on the day. Enjoy it. See you in Sydney, Melbourne, and Singapore.